Good afternoon, and thank you for being here today and for continuing to cover all the news that's impacting Louisiana, but especially now the COVID-19 pandemic. I am joined today by my good friend from Monroe, Dr. Lester Wayne Johnson, who is with LSU Health in the Shreveport and Monroe areas. He's going to speak and offer some prepared remarks in a few moments, and he'll, of course, take your questions once he concludes his remarks. We are also joined again today by Dr. Joe Canner with the Louisiana Department of Health. He'll be available to address any questions you all might direct towards him. As I think you know, a couple of days ago, I had the honor of attending a vaccine summit at the White House, and Louisiana was chosen. I was invited based on the strength of the vaccine plan that we presented to the federal government in working with HHS, with Operation Warp Speed and the White House Coronavirus Task Force. At the summit, there was a lot of information that was presented, a lot of questions around the vaccine and distribution. First of all, I want you to know we are confident that multiple COVID-19 vaccines are forthcoming in the very near future. And ultimately, that is how we are going to end this pandemic. But that's not going to happen for a long time, for a number of months. And so everybody needs to have that clear expectation from the outset. And it's really important that we start administering the vaccine, but it's going to take a while to get that vaccine widely administered to the point where we can start to put this pandemic in our rearview mirror. It should bring some comfort to the people of Louisiana to know that the Department of Health has been working on a vaccine plan since this past spring. And working with the CDC, with Operation Warp Speed once it was created, with the White House and others. And created here in Louisiana the Vaccination Action Collaborative with 4 different work groups, but spread across dozens of individuals who come from the public sector, the private sector, higher education, different foundations, and so forth, to ensure that when a vaccine became available to us, we would have a comprehensive plan for how to receive and store and transport, distribute, administer these vaccines. And I will tell you that we expect that that's going to happen relatively soon, and Louisiana is ready to go. And that pertains to the Priority Group 1A that you have been hearing about, and the one that the Advisory Committee on Immunization Practices, ACIP, reported the other day. And so this is one of the greatest scientific achievements of our time. I am very appreciative of all the people who have played an important role in making this possible. You know, while unprecedented worldwide urgency and resources and attention are being poured into this effort, I do want to assure everybody that all the standard safety steps have been taken. And so we end up with a vaccine that I believe could get an emergency use authorization very soon that is both safe and effective. And it is safe, and I'm very confident of that. And I will say, just generally speaking, that vaccine development can sometimes take 6, 8, 10 years, and you do things sequentially. And only after they get a safe and effective vaccine do they then go into mass production. Well, in this situation, all of these steps were taken concurrently at the same time, including the mass production. And so when the emergency use authorization is issued by the Food and Drug Administration, I am extremely confident that we will have a vaccine that is safe and effective, and that every time they issue a new emergency use authorization for a different vaccine, which, for example, the Moderna could come a week or so after the Pfizer vaccine, that too will be a safe and effective vaccine. Now, we do believe that the Food and Drug Administration may issue the emergency use authorization as early as today. And if that happens, or if it's tomorrow, we know we're only days away now of receiving our first doses of COVID vaccine here in Louisiana. Would be the Pfizer messenger RNA vaccine. And we've still got some steps that have to be taken. What we know from Operation Warp Speed and from briefings we've had with General Perna is that the shipments of the Pfizer vaccine will go out within hours of the FDA issuing that emergency use authorization. It's going to go out via FedEx and UPS to locations that we have already identified, and we did that a number of days ago, and then we will have it in state. We cannot actually use those vaccines until the head of the CDC, Dr. Redfield, actually authorizes us to do that. He will receive guidance from an independent panel. He will make that determination, and once he does, we can start administering that vaccine. We think that all of these additional steps will happen relatively quickly. And so it is possible, and I can't say for certain, it is possible that late this weekend, early next week, we will actually have and be administering the Pfizer vaccine in Louisiana. We do anticipate receiving right around 39,000 doses in the first allocation that comes to Louisiana. And then a week later, we expect to receive another 40,000 or so. You know that this is a 2-dose vaccine, and we are not going to be holding on to half of our vaccine and only providing that first injection to a smaller number. And in fact, the decision was made at Washington. They're going to hold on to half of what they have available. We are not going to do that in Louisiana, and they've assured us that we will be receiving shipments so that the second injection can happen 21 days later for all those individuals who receive their first injection. So we will not be holding the vaccine back. Everyone is going to eventually, obviously, have the opportunity, and I do hope that everyone will take advantage of the opportunity they're going to have to be vaccinated. But because the vaccine is going to come in smaller amounts initially, it was necessary to establish priority groups for the first vaccinations. As recommended by the CDC and consistent with the Advisory Committee on Immunization Practices, and as reviewed by our health department, I have agreed that we're going to adopt the ACIP recommendations for priority 1A. And with respect to the Pfizer vaccine, that means it's going to go to our critical hospitals, our Tier 1 hospitals, for hospital personnel, not just your healthcare professionals, but including obviously doctors, nurses, and therapists, but also others who work at the hospital who also are exposed to individuals and to conditions which can transmit COVID. So it will include, for example, the food service personnel and folks who go in and clean the hospital rooms and turn them over. It'll also go to EMS workers, whether they work for an ambulance company, public or private, and many fire departments across the state of Louisiana have EMS services integrated into their operations as well. So those are the folks who are going to get the Pfizer vaccine, and it will take some time to make that happen just based on our allocation of vaccine. And I will reiterate to you all very quickly, it's a pro rata percentage of the 64 jurisdictions that will be receiving vaccines. And our pro rata percentage is 1.46%. And it's based on the population above the age of 18. And it's 64 jurisdictions because it's 50 states, 8 territories, and then there are 6 very large urban areas that get their own allocations made directly. They don't flow through the states. Now, with respect to this other portion of Priority 1A that came from the ACIP, those are nursing home and assisted living center residents and staff. They are also in priority 1A, and they will be getting the Moderna vaccine, which we hope could receive a emergency use authorization by the FDA as early as December the 17th. So about 1 week behind the Pfizer vaccine. And you should know that the Moderna vaccine and the Pfizer vaccine are extremely similar. They're both messenger RNA vaccines. And it's no wonder then that they both have an efficacy rate of 95%. And by the way, it's 100% in preventing severe cases of COVID. But in terms of preventing COVID altogether, it's 95%. And obviously, it's safe as well. But it doesn't have the ultra cold storage requirement. And so we are going to use the Moderna vaccine to go to the residents and staff of our nursing homes and and our assisted living centers, all of whom have chosen to contract with CVS and Walgreens to actually administer those vaccinations. That is something that was put together at the federal level, made available to us. And if you watched the vaccine summit at the White House on Tuesday, you saw representatives of both CVS and Walgreens there talking about how they would make that happen. The vaccine will become more widely available and after priority 1A, obviously, and then we will have different priorities established because we're never going to, I'm not going to say never, but initially we're not going to have enough vaccine to just get directly to the general population. We're going to wait and see what the Advisory Committee on Immunization Practices comes up with for the second order and third order priorities. We do hope to be able to conform our plan to those priorities, and we expect in very large part we will be able to do that. But you should know that we're also going to take into consideration who it is that's populating our hospitals at that time. Because what we want to do is to preserve hospital capacity and lives. And so we're going to make sure that whatever we're seeing in our hospitals is reflected in our next order of priority. We also are going to make sure that there's a heavy dose of equity associated with the administration of the vaccine as well. So those will be the guiding principles, but we don't have those second and third order priorities established yet, and we're not going to get in front of that next ACIP recommendation. And so we want you to have all this so that you can know what's going on. We're going to be as transparent as we can possibly be. We want everyone to have trust and confidence in the vaccine so that they will actually get vaccinated, but also in the process itself. And I'm never going to say that it's perfect. There are so many moving parts. We're going to learn. We're going to have to make adjustments. Even though we have rehearsed extensively with tabletop exercises, we've had mock distributions around to different healthcare providers. There's no doubt that we're going to be having to make adjustments. But you have a tremendously dedicated and talented team here in Louisiana working at the Department of Health, but also all of our partners in the public and private sector across the state that are committed to making this happen as smoothly and as quickly as possible. But the general population, we're going to be some time before we can get to everyone. And so we do ask for everyone's understanding and patience. In that regard, we're going to do it as quickly as we possibly can. And so while there's certainly hope on the horizon as it relates to vaccines and vaccinations that will eventually allow us to put this pandemic in our rearview mirror, that's not going to happen real soon. But what is happening right now as we speak is a tremendous surge in positivity rates, in cases, and hospitalizations, and quite frankly, in an unacceptable number of deaths. All of which we believe are going to get worse, not better, because that's what we've been told to expect. That's going to happen across the country. We're not going to be an exception to that. We are in the middle of a dangerous third surge here in Louisiana. We are very concerned about the threat this poses to the healthcare system. Because we want to make sure we have the capacity to deliver life-saving care to everyone in Louisiana who needs it. And whether it's because of COVID that they need it, or it's because of a stroke or a heart attack, or because they're a cancer patient, or they just had a motor vehicle accident, it doesn't matter. If you need a hospital in our state, we want to make sure that there is a bed, that there are supplies, the therapeutics, and there's a staff. And quite frankly, it's the staffing that we are most concerned about right now. There are only so many doctors, nurses, therapists in Louisiana, and it's very difficult to get them to come from outside the state when all states are surging at the same time. Now, on November the 13th, we reported a new record of our own. It was the biggest single-day increase reported since the start of the pandemic in Louisiana, just shy of 3,500 cases. Now, that was 2 weeks after Halloween, right? And also 2 weeks after, I believe, the petition that was signed and caused a lot of confusion, where people were told, okay, there's no longer a public health emergency, you don't need to wear your mask, you don't need to distance, which was wrong on all counts. The public health emergency remained in effect, but it was absolutely essential that people do those things. But 2 weeks after that, we had right at 3,500 cases. Yesterday, if you were paying attention, on the 9th month anniversary of the identification of our first COVID case, we broke that record when we reported 4,339 new cases. That came 2 weeks after the Wednesday before Thanksgiving, when we know people started traveling, they started gathering, and they started their holiday activities. Today, we reported 2,542 new COVID cases, bringing the total to 261,329. I want to remind y'all, these are all cases confirmed by positive test results. 40 to 50% of people who have COVID never have a symptom. Most of these people never get a positive test result. And so the number of people in Louisiana who've had COVID could be as much as twice the number that I just gave you. Very sadly, today we're reporting also an additional 40 COVID deaths, bringing the death toll to 6,426 here in Louisiana. To date, more than 3.8 million tests have been reported to the state of Louisiana. In December so far, a total of 334,324 tests have been reported. Currently, and this is the statistic that causes me the most concern, 1,529 COVID patients are hospitalized across the state of Louisiana. Now, that is down 8 from yesterday, but I already know tomorrow we're going to report a significant increase. We have increased the number of COVID patients in our hospitals very substantially over the last several weeks. And quite frankly, it's at a trajectory we cannot sustain for much longer if we want to preserve that capacity to deliver life-saving care, which is why I am imploring everybody in Louisiana to embrace the mitigation measures that work. They're literally the only thing that we can do over the next several weeks in order to try to reduce transmissions, reduce hospitalizations, and reduce deaths. As LDH reported yesterday, our statewide percent positivity is now 10.7%. The last time I reported that number to you, it was 7.8%. In fact, it hasn't been that high since back in the July-August time period, our second surge. Based on the contact tracing work that's going on, we know the 5 top outbreak settings in terms of cases are food processing, industrial settings, bars, religious services and events, and restaurants. We are very concerned about the increase in positivity, because so long as that's increasing, then you have every reason to believe that all the other indicators are going in the wrong direction too. And so we really need to get that positivity to decrease. That is only going to happen if we get more people, many more people all across the state of Louisiana to do those things we've been asking for that we know work, that have proven effective in the past in flattening the curve and reducing transmissions. 48 out of 64 parishes have percent positivity right now greater than 10%. That was up from 23 parishes. Only one parish has a percent positivity currently below 5%. We are, again, very concerned about our congregant settings for older Louisianans, whether they're nursing homes or assisted living centers. And quite frankly, when you have high degrees of community spread, it is virtually impossible to keep the disease out of those congregant settings because you have staff going back and forth all the time. And I will tell you some tremendous work being done to protect the lives of individuals who are in these congregant settings. But we are very concerned about what we're seeing there too. The latest White House Coronavirus Task Force report stated that the current vaccine implementation will not substantially reduce viral spread, hospitalizations, or fatalities until the 100 million Americans with comorbid health conditions can be fully immunized. And that's going to take until late spring. Now, the good news is it's not going to take forever. So as we ask people to double down on the mitigation measures, we're not asking people to do it forever. There really is light at the end of the tunnel. In the short term, that light is a freight train. It's called a COVID surge coming at us, but there's also the vaccine and the promise that it holds for finally ending this pandemic. But until we can get there, we need people here to embrace all of these mitigation measures. And I think Dr. Johnson, who you're going to hear from in just a minute, the way he puts it, if we let up on mitigation measures now, it's like fumbling the ball when you're going into getting close to the end zone. We just don't want to do that. And I always think it's appropriate in Louisiana to use football metaphors and analogies because it seems to communicate with people a little bit better. Speaking of Dr. Lester Wayne Johnson, I'm going to ask him to come up now and share with you what he's been seeing in North Louisiana and what his thoughts are about the vaccine and so forth. And then when he finishes his remarks, if you will be so kind, please address whatever questions you have for him. And then on the back side of that, I'll come back up, complete my remarks, and then take your questions. So thank you.
Thank you so much, Governor. I really appreciate the opportunity. Your friends from northern Louisiana, any number of them, have asked me to pay our absolute highest regards to both you and the First Lady for a certain constancy of kindness that both you and she have shown to all of the citizens of Louisiana during this year of plague and hurricanes. We are so comforted because of that you inhabit this office at this time and have been there for us. So thank you both. Please give her our highest regards and our best wishes for what you do for all of us. The governor kind of used one of my metaphors. I was in Bud's Mini Mart in Rayville, Louisiana early this morning before I came down, and I had a patient of mine from years gone by that, of course, everybody is seeing the information that's coming from Washington, the great news about the vaccines' imminent arrival in Louisiana, and he asked me, he said, well, Lester Wayne, does this mean we're on the 1 yard line? And I thought about that a minute, and that's a wonderful question, really. I'm not sure that this puts us on the 1 yard line, but it surely, Governor, puts us somewhere inside the 20 in the red zone of getting through this plague. And so the question became, of course, and I've been to a lot of ball games with the governor, and I must say he's a real fan now. He gets a little bit, shall we say, involved, and particularly with referees, shall we say. But the point is, between the 1 yard line or the 5 yard line or whatever, There are a lot of bad things that can still happen to us before we make this touchdown. We can fumble, we can have interceptions, we can have bad referee calls, we can have whatever. So we need to not let up for a second now that we can see, hopefully, the end of this century plague. I mean, the worst healthcare disaster in a century for our nation. Those of us who have used the mitigation measures that the governor weekly implores us to do, those folks, the masking, washing of hands, avoidance of crowds, social distancing, all of those measures we should absolutely, each and every one of us, double at this point, now that we perhaps can see the end of it. And for those who have not chosen, for whatever reason, up to this moment in time, to use masking and the other measures, one great thing about us is we're Americans, and we have the right here to change our minds. We can change our minds. We have that opportunity. So give it some thought. Give it some thought now that you can. This is not, as the governor said, and it's hard to add. He's so thorough with his discussions every week. It's hard to add a lot to this without being redundant. But I would ask, please, give it some thought tonight if you have not used these measures for your family, for yourself, for your friends, and consider instituting them for the next few months at least until we gain herd immunity, which is surely going to be gained at some point in time. Because we don't want, none of us want to look back next summer or next fall on a sadness of having lost a loved one or a close friend that we may have had anything to do with because we did not do the best we could to protect that loved one. We don't want to have that as part of our next year's experience of what if we had done thus and so. So I ask those who have, the folks that have been vigilant, increase your vigilance. Those that have chosen not to, please reconsider. Reconsider, it's not that much of an inconvenience. We can see the end of it, as the governor has implored us time after time to do. Because, and I was thinking on the way down here, my dad told me something many years ago, until whatever the situation may be, until you've done all that you can do, you haven't done all that you can do. So please reconsider, and let's try to get through this together. Let's respect the governor and the folks from LDH that have worked so hard for us to try to get us through this, and see if we can't have a good Christmas this year with measures in place. And perhaps next Christmas, sir, will be really a time of great celebration. I thank you so much for what you've done for us and what you continue to do. And I'll be glad to take any questions about our experience in Northeast Louisiana or whatever you would like me to try to answer. Yes, ma'am.
Can you talk sort of anecdotally about what you're seeing in your region, both in terms of hospitalizations and in terms of use of masks and mitigation measures?
Yes, I wish I could say that my observation is that Northeast Louisiana is absolutely the best place for mitigation in the nation. I think that we are doing better we could do better than we have, as we could throughout the state and nation. We in northeastern Louisiana have, as the rest of the state has recently, seen a surge. We have not been overwhelmed at this point in my particular hospital at LSU Ochsner in Monroe, or neither have the other community hospitals there. But I must say, we are ever vigilant and watching hour to hour as to what may be coming our way. We have, I was telling the governor, reported to the governor that over the weekend, we had a couple of empty beds in our ICU. And as I think has led from the leadership of LDH, everybody in Louisiana has worked together beautifully to use the assets that we all have together. We took a patient from St. James Parish, one from Calcasieu, this weekend or Monday, that because they were running short of ICU beds in those particular localities, and we're glad to do that. And it's been our experience, by the same token, that if we need help from other regions, they're glad to help us as well. Did that answer you? Good.
Thank you, Dr. Johnson. And you all may remember that, I don't remember if it was last week or the week before, and we talked about the different regions of the state and where they were in terms of cases and hospitalizations and so forth. When you got to central Louisiana, and then you looked at northwest Louisiana around Shreveport, northeast Louisiana around Monroe, they never got their baseline down as low as the rest of the state before this third surge hit. And so you know, they're in a very difficult place as we continue to deal with this surge. And of course, I'm pleased that he's able to report to everybody today that they're not overwhelmed and that they still have some capacity, because we have to preserve capacity. But I do want to remind everybody that if I wait until Dr. Lester Wayne Johnson tells me he has no ICU beds before we take action, we have waited way too late, because this is a ship that takes weeks, literally weeks to turn. And it takes weeks to turn, at least 2 of them, on cases. It's longer than that to try to turn it on hospitalizations. And so you have to get out in front of that critical point, and you have to make decisions, and you have to ask people to do more. Quite frankly, we need to do better. I am so appreciative of the Louisianans who have been diligent in abiding by these mitigation measures and practicing them. But quite frankly, we need to collectively do better. You know, whether and to what degree we actually run out of capacity and potentially resort to crisis care, which nobody wants to do, depends upon the people of Louisiana. We've always been able to count on the people of Louisiana in the past, and I believe we can do that again. But we are going to have to do better. We want to return to normal. We want as much of the economy to be open as possible. We want our schools to stay open. We want our hospitals to have capacity. We want to protect our friends and family. That's why we have to do better. While the vaccine will be critical in ending the pandemic, it's not going to save us now. That's what people need to understand. It is not going to save us now. Here we are in the winter. We're in the heart of the flu season, and I do want to say that we have increased flu vaccinations by about 40% across the state from last year, which is good. And what we're seeing in our hospitals with flus is actually lower than it is across most of the country. And you've heard me say this before, but the same mitigation measures that protect against the transmission of the coronavirus also protect against transmission of the flu. And so we're seeing some of the benefits of that. But what we don't want is to have a surge of flu patients on top of a surge of COVID patients, because they're all utilizing the same aspects of the healthcare delivery system. And you can overwhelm that system very quickly. But here we are in winter. It's getting cold. It's raining. People are going indoors more than at other times of the year. That is the most dangerous place to be. Any activity is 95% safer outdoors than it is indoors with respect to COVID. And I know that right now families are making decisions about traveling, gathering, holiday-related activities. And as you do so, I encourage you to be mindful and to heed the CDC recommendations that are against travel. They're against normal activities. They're against multifamily gatherings where you have people from outside the same household coming together. I will tell you, we haven't seen the full impact of Thanksgiving yet. We're starting to see it now over the last couple of days in the cases. And as I mentioned, we fully expect the increased hospitalizations to come. But we're going to have a post-Thanksgiving surge superimposed on top of a surge we were already experiencing. If we also have a Christmas surge superimposed on top of that one, we're going to be in very, very difficult place. We don't want to resort to crisis care. I hope you were watching the other day when the Vice President came out and wrapped up the summit. And he pleaded with the American people to do the same thing that I'm pleading with the people of Louisiana to do, is to, yes, let's look forward to this vaccination to the end of the pandemic, but let's make sure that we are primarily focused on doing what we have to do right now to save lives and to be good neighbors to one another. He talked specifically about wearing masks, distancing, washing hands, staying home when you're sick. We have to reduce transmission now, and I want to tell you that there is a level of concern, anxiety, alarm expressed in the weekly report that we got from the White House Coronavirus Task Force that is about the country, but it is also specifically about Louisiana. There was a level of alarm there that, quite frankly, we haven't gotten before. And for me, having been at the White House and having an opportunity to speak directly to Dr. Birx, to Admiral Giroir, to Dr. Redfield at the head of the CDC, I will tell you that there is a real sense of urgency about what's going on. And we were there to talk about the vaccine. But there's no way to focus only on the vaccine right now. We have to do what is necessary. And one of the things that White House report said this week, and I think it actually said this last week too, if you are over 65, you should not go into any indoor space where there is a single individual without a mask on, unless you're in your home, and those are people from your immediate household. Think about that. And it isn't just the people over 65 who are vulnerable to this disease. We know it's people who have these comorbid health conditions. So if you're out there and you've got hypertension, diabetes, kidney disease, heart disease, if you know that obesity is a problem for you, then you need to be extra careful too. More compliance with mask wearing and distancing is absolutely essential. So as you make your plans for Christmas and for Hanukkah and for these holidays, if you're considering travel, please don't. If you're considering normal activities that you would engage in any other year, please don't. If you're thinking about having multiple households and multiple generations all celebrating together, please don't. And it pains me to say this, but I am absolutely confident that hundreds of families will go through Christmas without a loved one that was because we lost that person because of what happened at Thanksgiving. So the worst thing we want to do is compound that again. Let's be patient. Let's be diligent. Let's do what is required of us, and let's look forward to the end of the pandemic and celebrating Thanksgiving and Christmas next year the way we normally would. And you can show your love for your loved ones without being physically present with them. In fact, it's a damn poor way to show love to a loved one to give them COVID. Let's not do that. Everybody has a role to play. It is extremely important, and it has never been more urgent than it is right now. There is more COVID in Louisiana right now than at any time in this pandemic. I suspect there are not many people in Louisiana today who don't personally know someone who has died of the disease, who don't personally know multiple individuals who have had very severe cases requiring hospitalizations. And so if you need that boost in order to do what is urgently required, think of those people. Think of those families. Think of all the healthcare professionals who have been working so hard at great risk to themselves and their families since March. Dr. Cantor, is there anything you want to add? Okay. Thank you. At this time, I will take some questions. Yes, sir.
Governor, you've talked about the 79,000 doses we'll get of the vaccine in the first 2 weeks. Can you talk more about what we might know about the pace of distribution after that? Do you think we're going to be getting weekly allocations? Do you know how big the Moderna first batch is going to be? And also as part of that, I guess I'm trying to understand how long it might take to immunize all 200,000 plus of those phase 1A people.
Yeah, well, we don't know precisely the weekly allocations we're going to get beyond the first couple of weeks. We've been told to expect 39,000 doses of the Pfizer vaccine upon the initial allocation coming our way. Again, we think that could happen within the next couple of days, that we will start receiving that, and then we will start administering that vaccine within a day or two after that. We believe there's 40,000 doses coming of Pfizer in the subsequent week. I think we know the first couple of weeks of Moderna that we're expecting, and as well. Dr. Cantor, you have that?
Yeah, about 80,000 first week and 27.
80,000 in the first week? Okay, so the Moderna vaccine, we believe that if everything stays on schedule, somewhere around the 27th of December, 80,000 doses. And if you looked at the total number of individuals that we believe comprise the universe of critical healthcare workers and EMS personnel, you know that the amount of Pfizer doses I just told you isn't enough, not in the first 2 weeks. So this is going to go for several weeks, and it's also going to not be enough Moderna at the first time to get everybody who is in a nursing home as a resident or staff, or an assisted living center resident or staff in that first week either. And we also have to remember that the first shot isn't enough. We do believe that it confers some immunity on individuals, but it is not enough to really immunize anybody. And so that second shot is critically important. 21 days later for Pfizer, 28 days later for Moderna. And quite frankly, you're going to have more questions than I can answer for you today, because once we get past these first groups that are in priority 1A, we don't yet have an ACIP recommendation for exactly how we prioritize those. And I can't tell you what the allocations are going to be weekly coming in, although generally speaking, we believe that the manufacturing is going to be ramping up. We will be getting more doses, not less. And then also, we believe that additional vaccines, potentially up to a total of 6, are going to be available at some point while we're vaccinating against this particular disease. And that's going to play out over time. In each particular vaccine will potentially come with guidance that there are individuals who should not receive that particular vaccine, and we're going to have to make sure that we marry up the right people with the right vaccine. And so, as I told you last week, my expectation is to have a lot more information for you all next week with respect to vaccines. We will have hopefully by then receive the first allocation. We will see the vaccinations start. We will identify potentially some problems that have to be remedied. We will have more information about the Moderna vaccine. And so really, I'm hopeful that before Christmas, sometime next week, we're going to be able to give you a lot more information about what we're doing.
Just to clarify on that, so you do expect each week after this, from now going forward, we're going to receive some amount of doses of vaccine?
I do believe that that's correct. And Dr. Kenner, that's your expectation as well. And I want you to know, these are expectations that are informed by conversations that we've actually had. And so General Perna himself, who is over all of Operation Warp Speed from a logistical perspective, I was able to visit with him Tuesday, but moreover, on multiple occasions, he has made himself personally available to the Office of Public Health here in Louisiana, including all of those individuals who worked with the Vaccination Action Collaborative and came up with our plan and have been refining the plan every time we get new information about vaccines and about allocations and priority groups and all that sort of stuff. And so we have things that we believe will happen, but we also know that until it happens, it hadn't happened yet. And I don't want anybody out there to misunderstand or that we create some expectation that we're not able to meet. Yes, ma'am.
What to do to either incentivize or encourage these various frontline workers and nursing home and assisted living facility folks to and long-term care facility folks and their staff to actually get the vaccine? Like, I've already asked LDH, and they said that the state isn't going to require it of people in these facilities, but you obviously have the ability with financial incentives and with the money that flows to these healthcare facilities from the state and federal government to perhaps try and incentivize it in some way. Are you considering anything like that?
Well, what we're considering and what we're actually doing is we're trying to make it very clear to people that this vaccine is safe and effective. And if we're going to ever put this pandemic behind us, we need to be vaccinated in sufficient numbers that the disease stops spreading through Louisiana, through the United States of America, ultimately through the world. That's going to happen with the vaccine. And so what we've been trying to do is very clearly and effectively communicate the safety of this vaccine and the efficacy of the vaccine. And as more voices come online from a variety of different demographic groups, and whether they're young or old or African American or white or Hispanic, whether they're from the medical profession or whatever, and those voices speak out about the safety and efficacy of the vaccine, we believe people are going to take it. It's critically important that we do that. It's not going to be mandatory. I don't intend to make it somehow financially incentivize individuals to do it. I'm not sensing that, especially within the healthcare community, that there's much hesitancy at all with respect to the vaccine. And I'm very hopeful that as this goes forward with priority group 1A, that we have such a high percentage of people who are eligible who actually choose to receive the vaccine, and that people across Louisiana will say, hey, my doctor got it. I think I ought to get it too. Or however that needs to play out. But I just think we need to continue to focus on, I mean, look, there are many vaccines that actually get administered that never come close to a 95% efficacy rate. And there are many vaccines, I suspect, that have had side effects that are worse than this one, which a very small percentage of people will have some soreness at the injection site. Well, that's really common. And for a day or maybe 36 hours, they'll be a little sluggish. That's pretty common too. And that's what the vast majority of people who've had any side effects have actually experienced. So we need people to get the vaccine when it is available to them. And as governor, I'm going to make it available to you as soon as I possibly can, but creating as best we can the priorities so that we're vaccinating the right people as the vaccine becomes available to make sure that we're preserving capacity in our hospitals, that we're saving lives, and that we are being as equitable as we can possibly be. Yes, sir.
Hey, Governor. So I was wondering, with hospital capacities going up, are there any considerations within your office with moving back and increasing statewide restrictions like some other states have been doing?
Yeah, well, first of all, it's a great question, and at present, I am not, but as I've mentioned before and throughout this pandemic, my goal, and I think this was the first thing I said to Dr. Johnson when I saw him today, is my goal is to make sure he never has to engage in crisis care at his hospital, so that people are literally following a triage. You know, they say, well, you're less likely to survive this particular disease, so we're going to leave you in the hall, and we're going to take this other person, and they're going to get the room. And the staff is going to go in this room and take care of this other individual. In the United States of America in 2020, and in the state of Louisiana, we don't ever want to get there. And so I will do whatever I have to do with respect to imposing more restrictions in order to create the opportunities for people to make sure that they are distanced and they're not communicating this disease back and forth at the rates that they are now. But I will remind people that we are really where we were coming out of the summer when we slowed the spread and flattened the curve following the summer surge. So we can do it again. I only have to impose more restrictions if people don't do what they do then, and that is wear the mask, distance, wash your hands, stay home when you're sick. It's the same things we've been talking about literally since, March, April, whatever it was. So at this point, I am not considering those things, but everything is on the table because I never want him to lose the capacity in the hospital to accept the next person who needs that bed. And that next person might need that bed not for COVID, but because they had an accident, because they had a heart attack, because they had a stroke, because they have cancer, whatever it might be.
Governor, if I might just
Sure.
add one comment to that.
Come on up.
That what the governor says, it is in the past, at the beginning of this, when we had to restrict admissions to the hospital electively and even to some extent on urgent situations, because we did not know how many beds, how many ICU beds, how many respirators would be available. It is tremendously disruptive to the health care of every other illness imaginable to the citizens of Louisiana. So we thank you for being very, shall we say, conservative in mandating that at this point in time. We are, as I said earlier, vigilant beyond belief as to what our assets are, both in staff and in beds in these hospitals, to take care of this potential COVID surge. But if we get to the point, because of not using the mitigation measures that we should maximize at this point until the vaccine gets through here and we get to herd immunity, then we will be in a situation where elective health care and even to some extent potential urgent type health care is adversely affected. So that in itself is a huge reason to take into consideration what the governor has asked us to do. It is truly a nightmare for folks, for the staff of the hospitals throughout Louisiana, to think about to triage who gets placed on a respirator and who does not. That is not something we have faced yet, thank goodness, Governor, but it's out there as a possibility if we don't take care of things the way that we should right now. Sorry for the interruption, but.
No, that's a great point. And so we heard from our hospitals how disruptive it was when we discontinued non-emergency medical and surgical procedures back in the spring. We had different reason to do it back then. It wasn't just about capacity, it was about PPE, because we didn't have enough PPE to go to the hospitals to treat COVID patients. And so we needed to slow down other procedures where PPE was being used. There is a PPP out there too, but where it was being used. But you all should know that we have individual hospitals in Louisiana today that have electively decided, or have decided on their own, I should say, to discontinue non-emergency surgical and medical procedures if they require an admission. And so we have individual hospitals out there that are running so low on capacity that they're deciding for themselves to do this. Yes, sir.
We see on social media the fact that many people say they're not taking the vaccine, Governor, but could people not wanting to take the vaccine potentially hinder us from getting back to normal? And realistically, how many people in our state have to get vaccinated before we get back to that normal sense that we all crave, you know?
Yeah, first of all, the more people who get the vaccine, the sooner the better off we're all going to be, and the sooner this pandemic gets behind us, and so forth. So we know that. If enough people choose to not get it, then that's going to be a real problem. And that's why I'm doing everything that I can to promote what I believe is a very safe and very effective vaccine, the Pfizer vaccine, but also the Moderna vaccine. Any that get the EUA from the FDA, I'm going to feel very good about, because I've been part of this process since the beginning, with weekly phone calls with the White House Coronavirus Task Force, regular updates from Operation Warp Speed, and you have the leading scientists and medical professionals in the country and really around the world who are involved in this vaccine effort. And so, kind of like those people who, for whatever reason, haven't embraced the mitigation measures, and Dr. Johnson said, reconsider, please do better. If somebody's out there and they're thinking they don't want this vaccine, I'm going to ask them to reconsider, to go out and make sure that you're getting accurate information about it and not following baseless conspiracy theories. It's just really important. And it's not just important as it relates to the health of the individual making the decision. This is a public health emergency because this disease is extremely contagious, and it is extremely deadly. And so we need to make these decisions collectively for the good of everybody in our family, in our community, in the state. And so I encourage anybody who's tempted to not get this vaccine for any reason when it becomes available to them, to please reconsider that and listen to the leading healthcare experts from around the country and around the world. I want to thank y'all for continuing to cover this. We will plan another press conference for next week. I think we're going to look at Thursday again. And I apologize. I had to delay this one a little bit today because we had yet another call with the Health and Human Services Secretary about a new dashboard that they're setting up at HHS that will reflect everything relative to long-term care facilities and hospitals across the country, but in each state, in each parish or county, and every hospital district and every individual hospital. And so we were going through that with a demonstration, and that is why we had to push this one back. But we'll plan the next press conference for Thursday of next week. I look forward to seeing you all then. In the meantime, I will finish this conference as I do quite often. I'm going to ask the people of Louisiana as we move through Advent and approach Christmas and this holiday season that we really do pray for one another, that we pray for our country, that we can get through this crisis with the lowest amount of people dying as possible, while preserving capacity in our hospitals, and that we will all do our part, that we'll all be a good neighbor and wash our hands, make sure that we're masking up, stay 6 feet apart from people who are not a part of your immediate household, stay home when you're sick, and let's all protect the most vulnerable. Let's all protect the most vulnerable. and let's preserve that hospital capacity. It's critically important for us. Anyway, thank you and God bless. I'll see you next week.